What if I told you there was one common similarity between all the patients we see with low back pain? What if I also told you that by changing just two simple things, changing the way you're doing some of your stretches and then adding in a corrective exercise or two before and after your workout can dramatically improve this one thing? Now, what's the one thing all of our low back pain patients have in common? It's the limited ability to extend their hip without arching their low back to do so. Now, when trying to picture hip extension, think about the leg traveling behind you when you're walking. If you don't have enough hip extension, you'll compensate by arching your low back and pushing through your low back. That same hip range of motion is also required when we bend over and come back up to pick something up off the floor, or if we've been sitting in a chair to come back up to standing. Now, you may even be thinking to yourself, my back hurts when I do those things. This is a sign of limited hip extension because the body will compensate to make up for the limited hip extension by dumping the pelvis forward, and this can cause compression on the low back. So in this video, we're going to go over 3 ways to improve the body's ability to extend the hip without overcompensating or arching the low back. Plus, at the very end, I'm going to share one extra bonus tip that might be my favorite, so make sure to stick around to the end. Now, when we lose this range of motion, oftentimes because the back of our hip is so tight, the pelvis will dump forward, causing more compression on the low back. But that's not all. Also, the space where the sciatic nerve runs down the back of the leg, oftentimes when that's inflamed or irritated, you'll hear people refer to it as sciatica. That space where that nerve travels will actually get smaller, causing more symptoms to the sciatic nerve. So you can either have one or two of those symptoms, whether it's low back, compression, achiness, or sciatic-like symptoms down the back of the leg. Step 1 to fixing this issue is by releasing some of the tension in the back of your hip or the posterior capsule of the hip. Now again, when this space is tight, the pelvis will dump forward and cause a lot of compression on the low back. So imagine that this space is so tight that there's not enough room for your leg to swing behind you when you're walking or when you're standing up from sitting. So what we need to do is find some gentle stretches that can open up this space in the back of the hip without dumping the hips forward, which is our problem to begin with. The problem is when most people try to stretch this area, they go into way too much external rotation. When doing things like a figure 4 stretch or a pigeon stretch, this is just torquing the femur out into way too much external rotation, which most people already have an adequate amount of. We need to find a way to feel a stretch back here with driving internal rotation, and this is how you do it. So the first exercise we really like to open up the hip capsule is the kneeling wall walk down hinge. So Dr. Bates is going to walk his hands down the wall while sticking his butt back, and he's going to feel a little stretch in the back pocket of both hips. Once he feels that, he's going to hang out here and breathe for 5 to 10 breaths, and that stretch should get a little bit more intense as he breathes. Option number 2 is a standing wall walk down hinge. Now with this one, we want to put a pillow or a ball, something like that in between the knees just to keep the knees in line with the toes. Same motions apply. He's going to walk his hands down the wall while his butt travels backwards. His knees stay in the same place, and he's going to feel a good stretch in the back of his hip. So the third hip capsule stretch that we really like is a single leg version. You're going to get in this staggered stance with one leg slightly behind the other, and that leg should be elevated on a book or a surface about the size of 1 inch to 2 inches. You're going to sink back into that hip just like we did with the previous 2, and it could help to have something to hold on to, but this one you should feel a ton. You're going to hang out there for 5 to 10 breaths, opening up that space in the back of your hip. After performing 1 or 2 of those stretching variations, most of our patients will report an almost instant ease in which they're walking. It feels like they're not working as hard to walk or to bend over from picking something up. That's because all the space that we opened up in the back of the hip, now there's room for the femur to travel backwards instead of having to force through that position or to dump the pelvis forward and cause compression through the low back. Okay, now step 2 to fixing this issue is to train or to strengthen hip extension. And now when I say strengthen, I don't mean maxing out a deadlift or a super heavy squat or lunge. This is much more neurological in nature. Think mind-muscle connection. We want to connect where we push with the foot off the floor and what muscles we should feel during hip extension in some few simple exercises that then we can carry over to more effortful strength-based movements eventually. But for now, this is going to be very low key. This is something you can do from home, and it should feel really good to do if you're having low back or sciatic symptoms. All right, so the first exercise I really like to strengthen hip extension and really drive what it feels like to extend your hip without compensating or dumping your pelvis forward is this foam roll assisted hip extension. Now you're going to get on a firm surface, whether it's like a table like this that we have in the office or a dining room table or a bench, and slide a foam roller underneath your thighs. Now the down leg, so in this case, Dr. Bates' left leg, he's gonna gently push down into that foam roller, like a 2 out of 10 effort, and he's gonna feel the back of his hamstring slightly engage. Now, one thing I like to do with this in office with people is have people push really hard just so they can feel what it feels like to do this incorrectly. And if he pushes way too hard, he's gonna instantly feel his back extend and his low back kick on and engage. And that's what it feels like, or that's what it's like when we're faking hip extension and not doing it genuinely. This helps to drive actual hip extension without compensating through the low back. So the second exercise I really like for driving hip extension is a hook lying hip extension with your feet flat on the floor. So you can stay on the table that you're on or do this from the floor. We're going to take what we learned from the previous drill, pushing into the foam roller, and we're going to do the exact same thing, except this time we're going to push through our foot. So we're going to bring one leg up, and then the leg that's down, we're going to push gently into the floor through the ball of our big toe and through our inner heel. Now it's really important we push through those two parts because that's what's going to help drive genuine hip extension. So if he's pushing into the table there, like a 2 or a 3 out of 10, he should feel his glute kick on just a little bit and not his low back. If you feel your low back kick on or your hamstring cramping, you're trying way too hard, try less. Less is more with this. Again, this is very neurological in nature. Think mind-muscle connection. Now, once you have this position, you're going to hold this for 5 to 10 breaths, breathing in through your nose, silently as possible, and exhaling through your mouth like you're fogging up a mirror. As you breathe, you should start to feel this more and more. If you start to shake, that means you're probably trying a little too hard. Try a little less. If you're still shaking, that's probably your time to be done and move on to the next thing. All right, now this is exercise number 3, and it's a step up, but we're taking what we learned from laying on the table or laying on the floor with the first 2 drills and integrating it now to being on our feet. So what we're gonna do is we're gonna simply step up on the right foot, but pushing through those 2 contacts that we worked on in the previous drill, the ball of our big toe and then the inner heel, to push ourselves up. And we wanna be pushing as much as we can through the leg or through the foot that's on the box and not the other one. The other leg's just kind of coming along for the ride. When we're doing this, we should feel a good amount of muscle tension in a good way in the back of our hip. It should feel really nice. We're going to do this for 5 to 10, maybe even 15 reps slowly, and I want to emphasize coming up slowly for 3 to maybe even 5 seconds on the way up. So by doing exercises like this once or twice a day, specifically around your workout or around your activity, if you can, you're going to improve the body's ability to extend the hip without having to think about it. As more time goes on and the better you get at these, the more and more your body will naturally do this without having to think about it. Now that we've opened up space in the back of the hip with stretching, then we can move into that space by owning and controlling that space through these exercises. And eventually this will start to carry over into things like lunging and squatting and deadlifting, and you might start to feel more of your glutes than you did before instead of all that achy low back compression. The benefit of working with us in person is we get to combine all 3 of these things to improve hip extension, to take pressure off the back, all in one, and make it more custom to you. So you might have a lot of adhesion or nerve entrapment along your sciatic nerve. Well, we can break that up either with our hands or with the radial shockwave machine, and then go right into one of those specific hip capsule stretches to open up that space even more, followed by a little bit of rehab exercises that you do in between visits just to make that progress go so much faster than it could if you're navigating this on your own. The benefit, to sum it up, if if we can't genuinely extend our hip, if we don't have enough range of motion through the back of our hip, and we don't have enough strength or neurological awareness to push through the floor without arching our low back, this is going to cause more compression, not only on our low back, but our sciatic nerve. So by doing these stretches, strengthening drills, and in extreme cases, getting hands-on treatment, whether with our hands or with the Shockwave, you can dramatically improve your ability to extend your hip and take a ton of pressure off of your low back and sciatic nerve. All right, and for the bonus tip, the fourth tip might be my favorite just because it requires very little thinking, very little effort. You just need the right pair of supportive shoes. How do you know if they're the right pair of shoes? Well, number one, they're gonna have a fairly solid or structured heel that's not gonna allow your ankle to collapse inward or to roll inward. So the heel should be fairly firm, fairly solid, and not allow your ankle bones to roll inward. That's step one. Step two for a good shoe is that it has good arch support for your specific arch. Whether you have low, medium, or high arches, it should be specific to those. And whether we fit you for those or someone at a running store, a qualified expert at a running store fits you for those, it should feel really naturally good on your arch and very supportive. And then the third thing that we look for in a good shoe is that it allows for big toe extension. Think about your big toe going up towards the ceiling when you're pushing off. This ability to do this, the shoe should help support that. Now, we really like Hoka's for that specific reason. If you have really stiff big toes, or a shoe like a New Balance, an Asics, or a Brooks, if you have pretty decent big toe extension. I would recommend getting fit for shoes. I can't recommend that enough. It's something we do here in the office all the time, and it's amazing how much it can improve things quickly when you get in the right pair of shoes. Really important after trying anything like this, whether it's an exercise, a stretch, a pair of shoes, that your range of motion should instantly improve or get better. Things like hip extension that we measure here on the table, his leg should instantly feel lighter and that it can move back farther without arching his low back. Things like hip flexion should feel easier and less compressive on the front of the hip, and things like hip internal rotation should dramatically improve as well. It's really important to measure these pre and post so you know the stretch is right for you, or the exercise, or even the pair of shoes is right for you. This is something we measure in office at every visit to make sure what we're doing is actually benefiting you and not making you worse. You'd be surprised, the wrong pair of shoes, a stretch that's not right for you, and these tests will dramatically get worse and more painful. So to sum it up, hip extension is a really big deal. When we don't have it, our body will find easier ways to manufacture it or to fake it by extending our low back or turning our feet out or sticking our big toe out to the side. That can cause bunions. We will find ways to fake this, and this is what can cause a lot of the symptoms that we see in the office as far as low back pain or sciatica or hip pain, and addressing this can go such a long ways into start to improving those. So make sure to try these three things, whether it's the stretches, the exercises. If those aren't moving the needle enough for you, that might be where we need to do more hands-on treatment with our hands or with the radial Shockwave machine. Plus, get fit for good shoes. I can't stress that extra bonus tip enough. When you're in the right pair of shoes, it makes walking and standing and running just so much easier for you to extend your hip without arching through your low back to do so. And last thing, if you're ready to go all in on fixing these problems and you've tried some stuff at home and nothing's quite working for you, maybe you've seen a few providers and you're ready to go all in to fix this, give our office a call or shoot us a direct message on Instagram. I'd love to meet with you, whether in person or over Zoom is your preference, so we can get to the bottom of what's causing your symptoms and build a customized plan to help you start feeling better. Thanks.